Ang tunay na pangalan ng mga tao, lugar at organisasyon na may kaugnay sa liham na tampok sa palabas na ito ay pinilitan at binago. Ang anumang pagkakahawig ng mga bagong pangalan sa aktwal na tao, lugar o organisasyon ay hindi sinasadya at nagkataon lamang.
Magandang araw mga consumer! Ngayong linggo sa Dear Consumer Care, isang liham na naman ang sasagutin natin at ang ating pag-uusapan ay patungkol sa No Return, No Exchange Policy. Ito ay isa sa pinakamaraming tanong na ating natatanggap sa Consumer Care. Kaya ngayong araw, ating sasagutin ang sulat mula kay Binibining Mulya. Dear Consumer Care, magtatanong lang po sana ako. Nagkamali po ako ng bili ng isang item sa isang store. Noong magre-request po sana ako para palitan ng item, ang sabi ng customer service ay nagpapatupad daw ang DTI ng No Return, No Exchange Policy. Totoo po bang ipinatutupad nyo ito? As a customer, minsan po talaga ay nagkakamali kami ng aming pagbili. Maraming salamat po. At para sagutin ang katanungan ni Binibining Mulya, kasama natin ngayon ang Assistant Director ng Consumer Policy and Advocacy Bureau na si Attorney Cheryl Carbonell. Magandang araw po, Attorney Che.
Magandang araw din sa iyo, Dens, at sa ating mga consumers.
Attorney Che, maaari niyo po bang bigyang linaw kung ano itong No Return, No Exchange Policy na ipinatutupad daw po ng DTI?
Linawin ko lamang, Dens, ang No Return, No Exchange ay hindi ipinapatupad ng DTI. In fact, ito ay ipinagbabawal sa ilalim ng Consumer Act of the Philippines o RA 7394. Ayon sa batas, bawal na ilagay o isulat ang no return, no exchange sa alinmang resibo o sa alinmang area ng tindahan o anumang dokumento na napapatunay ng bentahan.
Bawal po pala ito. Bakit nga po ba ipinagbabawal ang paglalagay ng no return, no exchange sa mga resibo o kahit anong dokumento na nagpapatunay ng bentahan?
Ito ay dahil lumalabag ito sa karapatan ng consumer na maipasaayos, mapalitan o ibalik ang ibinayad kung ang nabiling produkto ay may sira o depekto. Kung naalala mo yung ating 3 R's, repair, replace at saka refund.
Paano naman po kung nagbago talaga ang isip ng consumer? O hindi naman kaya nagkamali talaga sa pagbili? Hindi na po ba talaga ito pwedeng papalitan?
Ang pagbabago ng isip ng isang consumer o ang kanyang pagkakamali ay hindi wastong dahilan para mapalitan ang produkto o kaya ay makakuha ng refund. Subalit, may mga seller na pumapayag na magpalit kung sakaling nagkamali ang consumer o nagbago ito ng isip. At ito ay ayon na lamang sa goodwill o sa liberality ng seller sa kanyang consumer.
Paano po kung ito ay aking ipangreregalo lang at hindi ko naman po alam ang tamang size ng aking pagbibigyan? Paano po kaya ang pwedeng gawin?
Makabubuting sabihin mo ito sa tindahan at alamin ang kanilang return and exchange policy.
Kaya mga consumer, tandaan na bawal po ang no return, no exchange policy. Kailangan meron tayong karapatan na maipagawa, mapapalitan ng produkto o may refund ng perang ibinayad natin sakaling may depekto o sira ang ating nabili. Subalit amin po kayong pinapaalalahanan na bago bili ng produkto ay siguraduhin na ito ang produktong nais bilhin dahil hindi sapat na dahilan ng pagbabago ng isip o pagkakamali sa ating pagpili. Makabubuti rin pong itanong sa seller ang kanilang return or exchange policy. Maraming salamat po, Attorney Che. At yan ang kabuuan ng ating programa sa araw na ito. Paalala lamang po na ang impormasyong aming naibigay ay base lamang sa aming natanggap na salaysay at mga pangyayari na inilahad ni Binibining Mulya. Abangan muli ang Dear Consumer Care sa susunod na linggo. Ito po si Denzel Bonal na nagsasabing, wise ang consumer na may alam. Para sa updates, please like, follow, subscribe to our Facebook, Instagram, Twitter, and YouTube accounts. That's DTI Consumer Care and DTI Philippines.
Ang tunay na pangalan ng mga tao, lugar at organisasyon na may kaugnay sa liham na tampok sa palabas na ito ay pinilitan at binago. Ang anumang pagkakahoy ng mga bagong pangalan sa aktwal na tao, lugar o organisasyon ay hindi sinasadya at nagkataon lamang.
Magandang araw mga consumer! Welcome sa programang Dear Consumer Care kung saan isang katanungan na naman ang ating sasagutin ngayong linggo. Ikaw ba ay nabiktima na ng mapanlinlang na gawain na may kinalaman sa pagbebenta? Samahan niyo kami at ating sagutin ang liham mula kay Ginoong Anderson. Dear Consumer Care, bumili ako ng 3 bote ng Appleton Estate 12-year rare Jamaican rum sa isang online platform. Ngunit mababang klase ng alak ang i-deliver sa akin ng seller. Hindi ito ang alak na aking in-order at binayaran. Hindi rin tinanggap ang request kong i-return ang produkto at mag-refund na lamang. Ano po ang dapat kong gawin? At para sagutin ang katanungan ni Ginoong Anderson, kasama natin ngayon si Ms. Werlyn Reyes-Lim ng Consumer Policy and Advocacy Bureau. Magandang araw po, Ms. Werlyn.
Magandang araw sa iyo, Dens, at sa ating mga consumers na patuloy na nakasubaybay sa Dear Consumer Care.
Ms. Werl, ano po bang masasabi niyo sa kwento ni Mr. Anderson?
Naku, Dens, ayon sa salaysay ni Ginoong Anderson, masasabi ko na may paglabag ang seller sa Article 50 o Deceptive Sales Act sa Consumer Act of the Philippines. Ayon sa batas na ito, ang Deceptive Sales Acts and Practices o ang tinatawag nating mapagdinlang na gawain ng isang seller or supplier ay labag sa batas kahit nito ay nangyari bago, habang o pagkatapos ng isang transaksyon.
Maaari niyo po bang ipaliwanag sa amin kung ano ang deceptive o mapanlinlang na gawain?
Itinuturing na mapandinlang ang isang gawain kapag ang producer, tagagawa, supplier, o nagbibenta ay naghihikayat sa isang mamimili na pumasok sa isang transaksyon sa pagbibenta o pag-upa ng anumang produkto o serbisyo ng consumer sa pamamagitan ng pagtatago ng importanteng impormasyon, maling representasyon, o mapandinlang na pagmamanipula. Sa kaso ni Ginoong Anderson, ang representasyon ng seller na ang kanyang binibenta sa platform ay Appleton Estate 12-year rare Jamaican rum, subalit hindi naman pala ay matuturing na isang Deceptive Sales Act.
Para po sa sitwasyon ni Ginoong Anderson, ano po kaya ang maaari niyang gawin?
Sa mga ganitong pagkakataon, ang mamimili o consumer ay maaaring tumangging tanggapin ang produkto at maaaring kansilahin ang kontrata. Kung sakaling ang produkto ay natanggap na, maaaring ibalik ang mga ito at bawiin o refund ang ibinayad ng consumer.
Paano naman po kung ayaw magbigay ng refund ng seller at kung ayaw tanggapin ang pagbalik ng produkto?
Maaaring mag-file ng complaint o i-report lamang sa DTI Provincial o Regional Office sa inyong lugar o mag-email sa Fair Trade Enforcement Bureau. Ang proseso ng pag-file ng complaint ay makikita rin sa DTI website or www.dti.gov.ph.
Kaya mga consumer, siguraduhin na tama ang binibiling produkto. Tingnan ng reviews bago bumili, lalo sa mga online platform, at bumili lamang sa mga mapagkakatiwalaan na tindahan. Para naman sa ating mga seller, tandaan na labag sa batas ang mapanlinlang na gawain o pagbebenta. Maraming salamat, Ms. Werl. At yan ang kabuuan ng ating programa sa araw na ito. Paalala lamang po ng impormasyon na aming naibigay ay base lamang sa aming natanggap na salaysay at mga pangyayari na inilahad ni Ginoong Anderson. Abangan muli ang Dear Consumer Care sa susunod na linggo. Ito po si Denzel Bonal na nagsasabing, wais ang consumer na may alam. Para sa updates, please like, follow, subscribe to our Facebook, Instagram, Twitter, and YouTube accounts. That's DTI Consumer Care and DTI Philippines.
Happy Tuesday po to all our participants, sa mga nakatutok po sa atin dito sa Zoom, and to everyone joining us live via the DTI Consumer Care Facebook and DTI Philippines YouTube. Magandang umaga po sa inyong lahat. You can still invite your friends and colleagues to join this webinar. Para po sa ating bagong participants, ang programa pong ito ay inilunsad ng DTI Consumer Policy and Advocacy Bureau upang makapagbigay ng kaalaman tungkol sa mga napapanahong topics na makakatulong sa atin para tayo ay maging wais, mapanuri at malayang mamimili. Ako po si Mean De Leon from the Consumer Policy and Advocacy Bureau, and I will be your moderator for today's webinar. Welcome po to our 212th webinar session. This morning's topic po is about the Department of Health Holiday Campaign, including the Iwas Paputol Campaign. Pero bago po tayo magsimula, we would like to give some reminders. Unang-una po, ang ating webinar session ay recorded. By continuing your participation in the meeting, you're also consenting that you may be recorded. We are encouraging you to stay at samahan niyo po kami hanggang matapos at sabay-sabay tayong matuto sa topic natin ngayong umaga. Ang mga sumusunod na reminders naman po ay para masiguro na smooth ang ating webinar session. Pakipalitan po ang format ng inyong pangalan, maaaring consumer, space full name o di po kaya ay pangalan ng company, then your complete name. Kung masyadong mahaba naman po ang pangalan ng company, kahit acronym na lamang po ang gamitin. Please turn off your mic during the webinar session unless you are requested by the moderator to speak. Para sa mga tanong, we are encouraging everyone po to click the raise hand button to directly address the speaker during the question and answer portion, or you may send in your questions through the chat box. At panghuli po, para sa mga naka-touch screen device, please avoid drawing or making annotations on the screen para hindi po natin ma-distract ang ating speaker at iba pang participant. Without further ado, let us begin this webinar session by singing the Philippine National Anthem to be followed by the invocation.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, telas ng silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyang ka ng magiting, sa manlulupin, di ka pasisigil, sa nagagang putok sa simoy at sa langit ng bagaw, ay hinatang tulang awit sa pagkayang minamahal. Ang isang ng patawad mo'y tagumpay na naghihiling, ang bituin at araw niya kailan pa may di magdidilig. Lumalang araw ng walhagin pagsinta, buhay langit sa piling mo. Ang ligaya ng pagkay ng amin, at mamatay ng dahil sa'yo.
Loving Heavenly Father, we come to you this hour asking for your blessing as we are gathered together in this webinar. May your blessings of wisdom and guidance be upon us all for the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. Bless also the participants so that they would be able to glean the information from this activity and share what we have learned in the spirit of your generosity. Lord, we bring you our prayers, our commitment, our gifts to you this day. Let us who have a keen dedication and awareness of your creation have courage and conviction that we are able to contribute to the sustainability of the earth. Inspire us as we make choices so that we will recognize the impact our lives have on our environment and our human family around the globe. Pour out your blessings upon us today, Lord. May each of our actions reveal our awareness that we are partners with you in the creation and sustainability of this earth that you have given to us to appreciate and enjoy. We ask this in the name of your Son. Amen.
Now, to formally start our session for today, we would like to call the Chief of the Advocacy Division of the Consumer Policy and Advocacy Bureau, Ms. Camille Castillo. Good morning, Ms. Camille.
Hello, good morning. Hi, Anne, can you hear me? All right. So mag-umaga po sa ating lahat. And thank you. Salamat po sa pag-join po ninyo sa ating Consumer Care Webinar Series for today. Alam niyo po, this is our second to the last year. And I hope that you will still be with us. Last natin this Thursday, no, for December. And ayusin po natin muli natin ang ating Consumer Care Webinar Series for the year 2023. So kita-kita pa rin tayo po in our Consumer Care Webinar Series. So for this session for today, what are the consumer rights that we will be exercising? Andyan po ang right to information, right to education, at lalo na po ang consumer right to safety. Bakit po? Because of the topic that we will be discussing, ito pong Iwas Paputol, no? Alam ko po, excited tayong lahat for our Christmas celebration this year. Kasi naman po, after 2 years na we were separated from our family and friends, no? And office mates, no? At kung sino pa yung ating mga sa gusto nating kasama for this Christmas celebration, hindi po natin nakasama because of the pandemic, no? Alam ko po, we all know that COVID, but not too much excitement naman po. Still, reminders for you para po maging ligtas tayo bilang consumer ngayong celebrate natin ng Kapaskuhan. Now, we are thankful for DOH for joining us. Maraming salamat po for accommodating our request. Every year po, namin partner, no, si DOH, natulungan tayong i-educate consumer, lalo na po pagdating itong ating celebration ng Christmas. Yes, the fireworks pong ginagamit ko kasi ako sa mga firecrackers, no. The firecrackers are all as cheer, no, and to bring festivity to our celebration. Pero po, mas importante po ang kaligtasan natin. Kaya makinig po tayo ngayon, this morning, to DOH to give us reminders and to educate us on paano po ligtas ang ating celebration this Christmas. So please join us and be ready with your clarifications and comments pagkatapos po ng presentation ng DOH. Maraming salamat po and we hope to see you again this Thursday together with Yusek Castello for our last session of the Consumer Care Webinar Series. Maraming salamat at maligayang Pasko po sa ating lahat. Gawing ligtas po ang ating mga sarili at ang ating pamilya this Christmas season. Thank you very much. Morning!
Thank you, Ms. Camille. Baka po may gusto po kayong i-announce or...
Oh yeah, by the way, sorry. Kasi sobrang and sa gusto namin kayong pasalamatan, meron po kaming impromptu raffle, no? Hindi naman po ganun ka-engrande ang aming mga premyo, pero po gusto lang po namin iparamdam sa inyo how thankful we are for always joining us here in our Consumer Care Webinar Series. Later po, at kasama sina Leah at sina Glyza, magkakaroon po tayo ng Paskong handog, pa-raffle para po sa ating lahat. Meron po tayong premyo. Anong prize natin, Mean?
Gift box, ma'am.
Okay, so may Noche Buena packaged pa tayo or GC? Sorry.
Gift box po, ma'am. Gift box.
Okay, so maghintay po kayo. So sana po maging active tayo para makasali tayo sa ating pa-premyo. Thank you.
Thank you po, Ms. Camille. Ayan. So, as one of our ways po of expressing gratitude to our participants, we'll be giving away 500 peso worth of gift packs to 5 lucky winners po in this year's Consumer Care Webinar Series Christmas raffle. To join po, the participants should register in the registration link that will be provided in the chat box by our webinar team. 5 lucky winners po will be given the 500 peso worth of gift packs each. So only registrations po made person will be eligible for the Christmas raffle. So make sure po na mag-register na po tayo. Mas maaga, mas maganda. So only those present during the draw will be eligible to win. So winners will be drawn po after the Q&A portion, and this is open po to all participants except CPG personnel. Metro Manila winners po need to claim their prizes at the DTI head office, while the DTI CIPAG po will coordinate. Yan. So we're back po. We apologize
Ang
po.
pangalan ng mga tao, lugar at organisasyon sa
We apologize po for the technical problem. Going back po to our speaker, he graduated from UP Diliman with a bachelor's degree in biology in 2005. His first exposure to public health came in 2009 when he served as a program manager for pulmonary TB with Tropical Disease Foundation. Currently, he is the campaign manager for environmental health, sexual and reproductive health, and the OIC campaign manager for violence and injury prevention, 3 of the 7 priority areas in the health promotion framework strategy of the DOH. He has represented the DOH in several engagements, including webinars, radio talk shows, and emerging online platforms such as Laz Live and Kumu to discuss health promotion campaigns of the DOH. He is currently the Supervising Health Program Officer of the Health Promotion Bureau. Ladies and gentlemen, let us all welcome Mr. Ricardo Noel R. Hervasio. Good morning po, Mr. Hervasio. The floor is now yours.
Good morning, Naan, and good morning, Ma'am Camille, and good morning to everyone.
Sir?
We can't hear.
Sir, we can't hear you po.
Hello, testing.
Ayan, sir.
Okay, sorry about that. I think nagpalit yung settings for a while. So good morning again, Ma'am Mean, and good morning, Miss Camille. No, thank you for having the DOH on your consumer care webinar series this year. No, it's very humbling for us, and it's a very good opportunity for us to be able to speak our message no, about Iwas Paputol. Sorry, I hope I'm coming in clear. Is the audio okay?
Sir, baka po pwede nating i-adjust para pong may nakatakip po dun sa mic. Baka po pwede din po natin i-boost yung volume, sir.
Wait lang po.
Okay, sir.
How about now?
Louder yan, sir. Mas okay po.
Okay, I don't know what happened with the system.
Ayan.
Bigla siya nag-iba kanina.
Thank you,
So,
sir.
yeah, I hope this is better now. So there, no. Again, no, it's December. It's the holidays, and it's really no, a time when people go shopping, when people meet up with friends and relatives. No, and sabi nga ni Ma'am Camille kanina, no, for the past 2 years, this is something that we weren't able to do. No, given that everyone was may lockdowns, no, may difficulties with meeting up with friends and relatives, and now, no, a lot of communities, a lot of areas are open again, no, and now is a good time for people to really enjoy the holidays. But of course, syempre, as with any time naman, even pre-pandemic, no, pag sa DOH, pag holiday season, it's always a time when we should think about our safety as well. No, and in the case, of course, of fireworks and fireworks related injuries, no, it's really a time na uh, gusto natin na safe ang lahat ng Pinoy from fireworks related injuries. So if I may, if we could launch into my presentation. All right. So good morning again to all our viewers. And I'm Dino Hervasio from the Health Promotion Bureau, no, of the Department of Health. And I'm here to present to you our DOH holiday campaign. But siguro before I go into that, I would like to talk about our bureau's mandate. No? The Health Promotion Bureau, I think, is the youngest, no, of the bureaus in the Department of Health. So we were only established as a bureau in 2020, and before that, we were a communication service. But the Department of Health realized the importance of promoting health and not just preventing diseases and negative health outcomes. No, so putting a premium on health promotion, and with the Universal Healthcare Act, no, being implemented as well, the Health Promotion Communication Service was elevated to a bureau status. Now, next slide, please. So I'll go into the mandate first, no, of the Health Promotion Bureau. No, so when we talk about what makes Filipinos healthy, traditionally, what comes into people's minds is ay ospital, ay clinic, di ba? Nagpapagaling, nagpapagamot sa doktor. But actually, only 20% of our health comes from a quality healthcare setting. So getting access to quality care only forms a small percentage of what makes Filipinos healthy. In fact, a huge percent of what makes us healthy can be traced back to where and how we live. No? So, socioeconomic factors such as our education, our job, our income, of course. Now, these play a huge role in what makes us healthy. Of course, our physical environment. No? May tamang sanitation ba dun sa area? No? Is there a nearby dump that isn't regularly cleaned? No? That can bring disease or other vectors of disease to your area. And of course, one part here is yung healthy behaviors natin. So our healthy behaviors, there are 4 that are listed here, but actually there are 7 na pag-uusapan natin. Okay? Slide please. So if we look at it, no, there is a multi-sectoral place here now that is all about protecting and enabling Filipinos to care for themselves and for their community. And this is where we put the onus, no, on healthy communities, healthy schools, and healthy workplaces. So it's not just the health sector, no, that is in charge of keeping people healthy, but rather different sectors as well, no, including ang ating trade. No? Yung DTI natin is in charge of that. And health services are there to take care of Filipinos when needed, yung last 20%. Pag hindi na tayo healthy, no, kapag may negative health outcomes na, doon lang kailangan dapat ng Pilipino ng quality healthcare. Okay, next slide please. Because of that po, no, the Healthy Filipinas brand was created, no, under the Health Promotion Bureau. So under the Healthy Filipinas brand, we seek to establish a Philippines where Filipinos, no, individual Filipinos are health literate and health seeking. So doon po yung Doon po yung health promotion natin to individuals, to different people. Settings natin, I showed them kanina, no, yung ating communities, ang ating workplaces, ang ating schools, no, yung settings natin are health enabling. So, examples po ng health enabling settings. No? For example, in your compound ba, may speed bumps to reduce road accidents. May no smoking sign to deter people from smoking, no, in the office. So, are your settings health enabling? And of course, yung governance natin has to be health supporting as well. So if there are laws or regulations that really support healthy lifestyles, then of course, it's easier for Filipinos to become healthy. No? So the Healthy Pilipinas mission is to establish a Philippines, no, where healthy behaviors are the easier choice for everyone, all Filipinos, everyone in the Philippines, every time, everywhere. So next slide, please. So this is a medyo crowded slide, no, and it's hard to see everything here. But this is the health promotion framework strategy, which is our roadmap, no, to a healthy Pilipinas by 2030. So yung green areas po, that is yung mission, and values ng Healthy Pilipinas campaign. Yung orange squares po, no, yung orange shapes po dyan, are where we promote, no, yung Healthy Pilipinas natin. So we promote it across the first one, no, which is where you can see yung life stage approach natin. So from the womb up to your elderly life, up to the elderly stage, we want to establish that Filipinos can be healthy, whether you're a child, you're an infant, all the way up to the latest stages of your life, no? And also, we want to establish healthy behaviors across different settings. So, kita po dyan yung different approaches natin, the life stage and the settings approach. So, nakita po natin yung settings kanina, healthy communities, healthy schools, and healthy workplaces. Yung red shape po dyan is yung healthy behaviors po natin. So these are our 7 priority areas, and I'll go into them in the next slides. No? And last are the action areas where we want to promote yung 7 priority areas natin. So the first one you'll see there is developing healthy public policy. The second one is creating supportive environments for health. The third one is to develop personal skills. So dito po, for example, sa YouTube channel ng DOH or sa Healthy Pilipinas Facebook page, we remind people or we instruct them on different ways that they can be healthy. The fourth one is strengthening community action. So it's bringing the local government, civil organizations, advocacy partners to help create healthy communities or healthy settings. And the last one is reorienting health services. So na-mention ko nga po kanina na the Department of Health is putting a premium now on health promotion rather than just disease prevention. Now, if we can prevent people from getting sick in the first place, we will not be overburdening our health services. That's why we are seeking as well to reorient yung health services natin so that they don't just focus on disease prevention but also for health promotion. Slide, please. So the Health Promotion Bureau, no, is in charge of 3 health promotion campaigns. So the first one is
Sir,
health. Yes,
medyo
ma'am.
mahina po ulit.
Okay, let me. How about now? Is it
Sir, nawawala po yung audio niyo po.
how about now? Is it okay
Ayan,
now?
sir. Yes. Thank you po.
All right. So sorry about that again. No? So yung Health is Life campaign po natin is our campaign that focuses on yung health promotion framework strategy. So yung pinakita ko po kaninang previous slide, that's where the Health is Life campaign focuses. The second one is our Consult Tayo campaign, which is our interface with disease prevention. No? Disease prevention and control. So anytime po na sakit, no, na disease na po ang pinag-uusapan. So priority diseases po natin dyan ay, for example, HIV/AIDS, dengue, hypertension, diabetes. So any time that it is disease related already, it falls under yung Consult Tayo campaign natin. And the Consult Tayo campaign, yung main thrust po nito, yung main key message po nito is for Filipinos to seek consultation once they have signs and symptoms of a disease. Kasi alam nyo naman po tayo mga Pinoy, no, kadalasan nagpapakamartir, no, nagpapakalakas kahit may nararamdaman na. So for all our viewers this morning, no, there are 72 of us in the Zoom room and I'm sure there are a lot more watching online. Now, if you feel it, no, parang kung may nararamdaman na po kayo, magpakonsulta na po kayo sa inyong mga primary care provider. And the third, and of course, I think this might be right now the most visible campaign, no, of the Department of Health, is a Booster Pinas Lakas. Previously, it was the Res Bakuna campaign. So of course, we are not yet out of the woods, no, pagdating sa COVID pandemic po natin. No, tumataas pa din po yung, nagkakaroon po pa rin po ng cases, no, of COVID, and especially ngayon po, no, na open na po ang economy, no, nagkaka-concerts, may mga taong pumupunta na rin sa mga bars, reunions, parties. Of course, the chances of spreading COVID becomes increased, no? So we want to promote that people could could be more could be healthier, no? Parang makakaiwas po tayo sa negative health outcomes ng COVID if we get boosted, if we get vaccinated against COVID. Okay. So next slide, please. All right, so na-mention ko po, no, na yung Health is Life is our main campaign. It's our flagship campaign that focuses on our HPFS, on the 7 priority areas. So these are the pillars on which health promotion efforts for improving health outcomes are centered. Okay, next slide. So I would like to talk about the 7 priority areas now. No? So the first priority area is diet and exercise. The second is environmental health. The third is vaccines and immunization. The fourth is substance abuse. Mental health is number 5. The sixth one is sexual reproductive health. And the last one is violence and injury prevention. So these are the 7 priority areas. So if you have been familiar, no, with the Healthy Filipinas campaign throughout the year, you've probably seen our different materials, no, on media, on TikTok, sa mga health centers po ninyo, na nakikita nyo po sana yung mga yan. And if you were to guess po, no, of course, yung Iwas Paputok campaign po, which we will be focusing on for the next slides po, of course, it falls under our violence and injury prevention priority area. But because, celebrations for the holidays don't just encompass paputok. Diba? Bakit po tayo magpapaputok? Or saan po nangyayari po yun na nagpapaputok po tayo? Usually nasa bahay. At pag sa bahay, may Noche Buena, may pa-party. No? So we also want to focus on our other priority areas as well. For example, yung diet and exercise. No? Clean toys, no? Yung buying age-appropriate toys, that's also part of violence and injury prevention. Sa mga bata po na nakakalunok po na ng small parts, no? Lalo na if you don't buy age-appropriate toys for young kids, no? These can become choking hazards. Yung environmental health po natin, that's taking care of our environment. No? So of course, the waste that we generate, no, kapag bumibili po tayo or kapag nag-unwrap po tayo ng gifts as well, no? And of course, pag parties, hindi po na nawawala dyan of course, ang alcohol. No? But we want to remind people, no, na of course, too much consumption of alcohol is bad. And of course, if you drink, please do not drive. That falls under yung injury prevention campaign po natin again. So if you notice po, no, from what I was saying, very integrated po ang ating 7 priority areas. No? I mentioned 4 of the 7 already. No? And of course, no, for example, meeting others, meeting your friends, of course, that's a mental boost. That's a mental health boost. So again, that's priority area 5 naman. So as you can see, no, that's one of our goals, no, for major events such as our holidays. Ma-focus po natin yung different priority areas po natin. Okay, so that will end the first part of my presentation, which is on our mandates, no, dito sa Health Promotion Bureau. So now I would like to give you if we go to the next slide, you'll be able to see our campaign for the holidays. So our campaign for the holidays, second year running na po niya, is Ligtas Christmas sa Healthy Pilipinas. So for year 2, we added po itong tagline natin, magdiwang ng kumpleto at ligtas. So if you notice, may 5 gift boxes pa din po sa ilalim, no? And for us, parang how will we still maintain our health, no, during the holidays in light of the ongoing pandemic that's still around, no? Magpabakuna or magpa-booster, still wear masks in crowded areas, ensure that there is good ventilation, good airflow sa inyong mga celebrations, no? Be sure to wash your hands. And this is not just for COVID, no? Especially before meals. Madaming kainan tayong ma-attendan. We'll get invited to a lot of parties. Make sure to wash your hands before and after eating. And of course, as much as possible, let's try to keep social distance pa din. Especially if you see that you or somebody else, no, may have symptoms of COVID or other, parang he's not in the best of health, no? So next slide, please. So every year, the Department of Health, together with other national government agencies and local government units and our partners in health, promote a safe and healthy celebration of Christmas and Christmas and New Year. With the new normal brought about by the pandemic, promotion of health and safety is more relevant than ever and should be made a priority in every household, workplace, school, and community in celebrating the Yuletide season. Next slide, please. Despite the limitations in social gatherings, Filipinos may still enjoy the holidays if health and safety are prioritized and minimum public health standards are met. So to make the celebrations healthier, health promoting practices can also be encouraged during the festivities and parallel activities. Next slide, please. So in addition to mention about the...
Sir, sorry, your audio po.
I don't know why, but my audio keeps switching.
Mahina pa rin, sir.
Is this better?
Yan, sir. Yes, sir.
Napag-combine ko yung
I
dalawa,
don't know
video
why.
and
Sorry,
design.
but my parang the settings keep reverting back to a preview, to the one that is not good. I don't know why that happens, but just remind me na lang each time.
Yes, sir. Opo. No problem po.
Okay, so apologies for the technical difficulties. That's the problem if you're doing things virtual, no? So, in addition to yung nasabing mga health promotive exercises po natin, to prevent firework-related injuries, of course, which are very rampant, no, during the holidays, the DOH issued policies to prohibit the use of firecrackers except in community display areas, to establish guidelines on violence and injury prevention, including fireworks-related injuries, and create a program management committee to oversee the implementation, monitoring, and evaluation of the violence and injury prevention program. Okay, next slide. Okay, so medyo technical yung previous slide, no? But for us kasi in the DOH, in the Health Promotion Bureau, our shared vision is that ang pamilyang Pinoy will still continue to celebrate and enjoy the holiday season by safely doing their holiday activities and consciously choosing healthier options during the festivities. So that is our vision. That is what we are trying to achieve. But of course, Filipinos have established holiday celebration rituals among families and friends, which includes traveling to attend parties, alcohol consumption, fireworks displays, and oftentimes large groups gathering together. So the holiday season is usually seen as a time of relaxation and people tend to forgo diets and personal restrictions. Guilty po ako doon, no? So just last just last weekend, no, may gathering, no, and of course, no, madaming food na nakahanda, no. So I'm sure a lot of our viewers can also relate, no, to the holiday festivities. Now, people tend to to forgo their diets, personal restrictions to enjoy the time with loved ones. Medyo minsan nga naman ano, parang killjoy. No, everyone is having fun, everyone is enjoying food. Pero kayo po, no, you're strictly following your diet. You know, hindi kayo masyado sa sweets, no, sa alcohol, no, parang nagtatagay na, no, and parang they're offering alcohol but parang ayaw, 'di ba? Parang medyo parang KJ ka. But of course, no, if we want to choose healthier options, that is our vision and that is what the DOH is trying to promote. Okay? Slide please. So the annual holiday campaign focuses on three components. So na-mention ko na nga po kanina is safe holiday activities amidst the pandemic. So ito po yung 5 boxes, no, na nakita po kanina dun sa ating key visual, which was still maintaining masks, proper hand washing, hand hygiene, Iwas, social distancing, ensuring that there is proper airflow, and getting boosted or getting vaccinated before going to your parties, just so that you're sure that you are healthier, no, you're more protected, you have an extra layer of protection against COVID. Then yung second key component po natin is healthy celebrations. So healthy handaan. So for this one, our thrust here is to eat in moderation and to follow yung pinggang Pinoy. Yung pinggang Pinoy, it would be yung plate natin would be consisting of 1/2 of fruits and vegetables, 1/4 of our protein, and 1/4 ng ating carbohydrates. Usually rice po yan. No, but for us, it's more staying in moderation lang, no? And ensuring that we still get proper nutrition from our diet, from our food. No, hindi lang panay dessert po yung nakokonsumo natin, which of course madami yan, no? Minsan nga yun pa nga yung mga gifts natin sa ating mga loved ones or mga friends. The second is on alcohol consumption. Actually for us po, yung priority area po namin on substance abuse is about avoiding alcohol. So as much as possible, please, I hope we can reduce or say no to alcohol as much as we can. And of course, if you are going to drink, please do not drive. So that is parang parang double na, no, yung nagawa natin. Parang we consume too much alcohol and we were a threat, no? Parang we were a danger, a hazard on the road. And the third one about healthy holiday celebrations is on healthy toys. So it would be good if we could ensure po yung sources po natin ng toys, no, are safe. May mga LED paints pa din po, no, there are some toys that have LED paint in them, LED content, and let's make sure that the toys that we gift are age appropriate. No, kung 1-year-old pa lang ang bata at madami pa siyang nilalagay sa kanyang bibig, let's not give toys that have small parts, no, that could be choking hazards. And of course, our third key component for Ligtas Christmas is prevention of fireworks-related injuries. So the icon that you see, no, caldero siya. No, it's a pot. But it's not for food, but actually as an alternative noise maker. So iwas tayo sa Paputok. So the DOH po, what we want to encourage is that everyone will attend yung mga community fireworks displays wherein the fireworks are handled by professionals. No? And that way po, no, it's in a controlled environment so that we can reduce the injury. So syempre our vision here is that there will be no injuries or deaths from fireworks related incidents. Okay, next slide please. Okay, okay, we can move to the next slide po. Okay, so yun po, no, that was our key visual again, and ito po yung 5 gift boxes po natin dun sa ating key visual. So these 5 will always be in our materials dito sa DOH. So getting vaccinated and boosted, wearing your masks, especially in closed settings, no, as much as possible. Hindi naman po all the time kumakain po tayo. No, so if you go back to talking or having fun, or you're just sitting around during the party, as much as possible, please wear your masks. Now, ensure that there is proper ventilation and proper airflow dun sa parties or dun sa gatherings po natin. Sanitize your hands, no? Wash your hands properly. And this does not just prevent COVID, no, but a lot of other diseases that we could get from consuming dirty things while our hands are dirty. And as much as possible, if we can, let's please limit yung distancing natin, no? Yung gatherings po natin to ensure na hindi po masyadong siksikan dun sa ating lugar. If the place is too small, for example, to accommodate ang ating buong barangay, no, then let's just invite yung mga closest po natin. No? Just to ensure that our gatherings don't are not too tight, no, not too close to each other. No? May konting social distancing pa din tayo. Okay, next slide please. So the following slides are our materials na po, no, that we are releasing. No? So if you are following yung Healthy Pilipinas Facebook page, these are materials that you will see. So this is our first key message on safe holiday activities amidst the pandemic. Washing your hands, meron po kami dyan on getting boosted, meron po kami on wearing your mask pa din. Okay, the second one is yung key message number 2, no? Choosing healthier options during feasts and similar activities. So hindi po masamang kainin ang lumpiang Shanghai, no? Pero mas maganda kung limitado po, no? Kung we still eat in moderation. One serving ang kainin. Kasi marami naman pong ulam. No? And if you are the host po sa inyong mga parties at home, let's try to ensure that we still have healthy options. No? May gulay po tayo, may prutas pa din po tayo. Para kahit makakonsumo ng iba't ibang pagkain, no, may healthy options pa din tayo. May nutritional value pa din yung mga kinakain natin. And the third one is yung key message, yung prevention of fireworks-related injuries. So if you notice, no, if you notice here, no, it's a complete hand, no, kompleto yung kamay, and the person is using alternative noisemaker, no, tambourine, and instead of showing no, yung very graphic na images. So last year po, no, we were focusing on more graphic images, showing you injuries, showing what could happen if you were injured by fireworks. So medyo kulang ka na sa 10 fingers. Now we're trying to look at it in a more positive light. No? We're trying to set more positive, happier instances. No? Na kumpleto, pasigla at kumpleto in a family sense, kumpleto tayong lahat kasi kunado at boosted na po lahat. Kumpleto ang ating mga daliri after New Year's Eve, no? So, yun po, Iwas Paputol, lubungin ang bagong taon ng masigla at kumpleto. Okay? So we have a couple of videos that we want to show. So the first one is our TV commercial about Iwas Paputol. Next slide, please.
Saan ka magbabagong taon? Sa bahay, nagsasaya kasama ang pamilya, o sa ospital na nakaratay na nasabugan ng paputok ang kamay? Nasa kamay mo ang desisyon. Saan mo gusto magbagong taon? Ipagdiwang ang taon na ligtas kasama ang iyong pamilya. Oplan, Iwas Paputok, Ligtas Christmas para sa Healthy Pilipinas.
Isang paalala mula sa Department of Health.
Saan ka magbabagong taon?
Okay, thank you very much, Ma'am Mean, for showing that. No? So, these ones naman po are our Iwas Paputok's what is in IEC materials. No?
Sir, yung mic niyo po, kindly adjust na lang po. Thank you, sir.
Are we good now, Mean?
Yes, sir. Better po.
Okay.
Much better.
Okay. So ito naman po yung ating mga Iwas Paputok information campaign. No? So in these ones, we are encouraging people to use alternative forms of noise making. So mag-karaoke na lang po tayo, no? Instead of using 5-star and other kinds of fireworks. No, let's use alternative forms of noise makers na lang. No, let's bang pots. Let's play loud music. No? So these are safer, no? rather than risk injury with fireworks. So and the last one, it will be our counter, no, for yung mga fireworks related injuries. No? Okay, so actually that is my parang kumbaga yung last presentation ko, no, of our Iwas Paputol campaign. No, and this year we will be coming out just like what we did last year. We had a jingle, no, to encourage everyone dun sa ating mga three key messages. So last year po we had one, and for this year we have a new jingle as well. Kaso po yung new jingle po natin for 2022, medyo na-delay lang po yung release and I was not cleared to present it po this morning. So for those of you who are not familiar with our jingle from 2021, that is what we will be playing this morning. And then I will encourage everyone to stay tuned sa Healthy Pilipinas Facebook page para sa ating 2022 jingle, no, for Iwas Paputok and for A Ligtas Christmas. So to close my program, Ma'am Mean, if we could play our jingle for Ligtas Christmas in the next slide.
Namamasko, suot ang masko, nakasanitize na ang kamay. I-minimize ang usapan, maaliwalas ang pagdarausan ng handaan. Kahit tayo lang, tuloy ang saya, makikita sa mga mata. Salamat sa pag-iingat, ang lahat magpabakuna na. Oh, oh. Ligtas Christmas sa Healthy Pilipinas. Stay safe to the max para sa Healthy Pilipinas. Damhin ang diwa ng pagdiriwang, biyaya sa bawat nilalang para sa Healthy Pilipinas. Bakunado man, bawal gumamit ng torotot. Mas malakas ang pananabik sa isa't isa, ngunit walang magpapaputok. Ligtas Christmas sa Healthy Pilipinas. Stay safe to the max para sa Healthy Pilipinas. Damhin ang diwa ng pagdiriwang, biyaya sa bawat nilalang para sa Healthy Pilipinas. Stay safe to the max para sa Healthy Pilipinas.
So thank you very much for listening for the last 3+ minutes, I think.
Sir, your mic po.
Again. Okay. Is this better now? Again.
Sir, mahina po.
About now, Mean.
Yeah, yan, sir. Yes, sir.
Okay. So sorry for all the technical glitches that happened. No, and thank you for listening for the past 30+ minutes. No. So the DOH would like to wish everyone, no, maligayang Pasko at ligtas na bagong taon. So thank you very much.
All right. Thank you po for that insightful presentation, Sir Dino. Thank you po for walking us through the ways on celebrating the holidays healthily and safely And instilling with us po, it's important not just for us, but for our families as well. Good morning po ulit sa ating participants here in Zoom and to everyone joining us via DTI Consumer Care Facebook and DTI Philippines YouTube. Before we proceed po with the question and answer portion, here are some reminders. Kindly stay muted po unless you are addressing the speaker and or moderator directly. Please be also informed po na makakapag-download po kayo ng copy ng presentation material after you accomplish the client satisfaction form that will be posted in the chat box section. Para po mas maging interactive ang ating Q&A portion, we encourage everyone po to click the raise hand button so we can call you to ask directly to our speaker. Pwede rin pong isend ang inyong questions sa chat box. To our participants po, may gusto po bang mag-raise hand? Yeah. While waiting po, let's go through po muna yung sinend sa atin na questions earlier. Sir Dino, with the onset and ongoing pandemic, bumaba po ba at patuloy po bang bababa ang rate ng fireworks-related accidents sa bansa? Since magre-resume na po ng celebration ulit ang ating ang general public kasi mas naging lax na po yung restrictions natin. Sir Dino?
Yes, Ma'am Mayan. No, so to answer that, back in 2020, we recorded the lowest number of fireworks-related injuries. And of course, malaking factor po doon. That of course, there was a pandemic. In 2021 po, may slight increase po given na medyo nag-open up na rin po yung economy by then. So this year, again, we are gearing up for siguro what we expect or what we think maybe another increase as of course lalong nagbubukas na yung economy. Maraming parties na po ongoing. The restrictions on gatherings are even more lax than it was last holiday season, December 2021. So, but before that, we had been, before 2020, before the pandemic, we had been enjoying 5 years na bababa. I think it's 4 years or 5 years of decreasing numbers of fireworks-related injuries. So, syempre, there was a sharp drop ng pandemic year and then a slight increase last year. So hopefully, is lower yung general trend, yung pre-pandemic trend na bumababa yung number of cases. Sana yun po yung umiral. May be hard to replicate what we had in 2020 just because talaga there were no gatherings in 2020. Mahirap talaga. I mean, it wasn't din naman possible to have community fireworks displays, fireworks at home. It's very hard to come by kasi walang gatherings. So hopefully, following yung larger trend, yung longer trend natin of increasing cases, yun po yung makita po natin this coming holiday season.
Thank you po, sir. Next question naman po, ano po ba yung dapat gawin na first aid response kapag may na-aksidente with fireworks? Or sir, baka po merong resources CDOH na our participants po can visit or open po in case po meron silang makitang incident po ng fireworks-related na injury po.
That's right. Thank you, Mayano. Unfortunately,
sir, yung audio niyo po.
Okay na. Yeah. Okay. So unfortunately, I am not with the Emergency Management Bureau, nor nor am I a doctor. Hindi po ako MD. I'll be able to conclusively answer yung questions about fireworks-related injuries. But pag nasugatan po, of course, get damp cloth para po tumigil po just to help it just to contain yung open wound para hindi po siya ma-infect. And then punta po tayo sa ating closest na health centers or yung mga emergency areas that are open. We will be sharing po yung mga emergency hotlines po natin on our Healthy Pilipinas Facebook page. We will also be releasing po video messages from our Health Emergency Management Bureau, videos on first aid for fireworks-related injuries. So these include po yung naputukan na daliri or other limbs po natin, or inhalation of yung toxic fumes po nung fireworks.
Thank you po, sir. Someone is raising po their hand. DTI Iloilo de Marsolina. May question po ba tayo kay Sir Dino? Okay. So baka po napindot lang yung raise hand button. Next question na po muna tayo. Sir Dino, ano po yung usual challenges ng DOH po during the holiday season? Ano po yung mga usual cases? Halimbawa po, tumataas po ba yung cases sa blood pressure po since handaan or bukod po sa firework-related injury, sir?
Yes, mataas din po yung instances po natin of consumption. I don't think we have numbers on kung yung tumataas ba yung cases of hypertension or diabetes. For example, especially from the holidays. But of course, kita naman, I think, kailan pong pinakamadalas na nag-e-enroll sa gym ang mga tao? Diba? It's usually in January, after ang holiday season, because of the weight that we gain during the holiday season. So of course, parang kita na po doon na yung ating diets and exercise, yung physical activity po natin, yung nutrition po natin was medyo compromised during the holidays. Aside po from yung fireworks-related injuries po, of course, we want to remind all Filipinos about the dangers of alcohol consumption and about going on the road after you have consumed alcohol. Just last November, we celebrated yung National Day of Remembrance for road traffic victims. Road traffic victims, survivors, and their families. Complete the name. So that was last November, and during the holidays po, syempre coming home from parties, marami po din pong instances. I'm sure, Ma'am Mean, kayo din. Ako din, parang before the pandemic happened, there would be days na you go from one party to the next. Siguro on a weekend, dalawa, tatlo yung parties na napupuntahan. And of course, if you consume alcohol at each of those parties, syempre, accumulating po yun in our systems, and making us a hazard on the road. So let's not make the holiday season a sad season for ourselves and for other people who share the road with us.
Thank you po, Sir Dino. Next question naman po, ano daw po yung other preparations of DOH for the holiday season, including on-ground preparations po? Siguro po, sir, ang ibig po sabihin dito nung nag-send ng question, baka po yung regarding code white advisories or preparations po ni DOH.
Yes, that's right. The DOH, of course, yung mga sentinel
Sir,
hospitals.
yung audio po.
Okay.
Thank you, sir.
Yeah, I don't know what's wrong with my Zoom today. But yung yung preparedness po ng ating hospitals, our different sentinel hospitals and our yung mga health units po natin are all gearing up po for yung Iwas Paputol, for the parang yung foreseen deluge of cases of parang fireworks related injuries or other injuries that are related to celebrations during the holidays. So our hospitals are gearing up. They're parang nag-release na po kami ng advisory sa ating mga health centers for them to be prepared during the the holidays, no? May ongoing coordination din kami with our other partners, no, during the holidays. So aside from DTI, of course, partners din po ng DOH ang PNP and ang Bureau of Fire Protection, as well as the DILG. So we are also coordinating with them so that there will be a parang coordinated and prepared response to activities and incidences during the holidays.
Thank you po, Sir Dino. May magandang suggestion po dito na sinend sa atin. Miss Gina Yap, I hope okay lang po na banggitin ko yung pangalan nyo, no? Ang suggestion po dito, sir, sana gumawa ng ad ang DOH on how we can also protect our pet fur babies kapag may fireworks during this holiday season. Tama naman din po yung sinabi ni Miss Gina na our fur babies po are also part of our family. Yan, sir.
I agree. No, as parang a dog lover in myself, no, parang our fur babies safe, no, during the holidays and especially during yung mga fireworks related activities. No, it's important. Actually, that could be one reason po why we not use fireworks, no, during the holidays. So instead po, if we can parang have a no fireworks zone in our households will be more quiet, more peaceful, more safe, no, for us and our fur babies. And then for those who want to attend fireworks activities, let's attend na lang yung mga community fireworks displays in our communities. Let's look for the nearest one and iwan na lang po natin yung pets natin sa bahay para hindi nila marinig yung mga paputok.
Thank you po, Sir Dino. Next question naman po. Sir, can you share with us po tips naman po on other priority areas like kanina daw po nabanggit po yung about sa diet and exercise. Sir, how about tips po on sa mental health and substance abuse during the holiday season, sir?
All right. For mental health, we have our mental health hotline as well. So yung National Center for Mental Health po natin. I don't have the hotline with me, but it's on our Healthy Filipinas Facebook page. So look for our posts po related to mental health. So of course, mental health is a time, no. I'm sure there are, while some people are happy, no, to be able to enjoy other people's companies during the season, may iba po no, na Pinoy who may be away from their loved ones, no, or the holiday season for whatever reasons sa kanila, so may not be the best season for them. So you can reach out po to your peer support groups. You can reach out to the NCMH. Their hotline is on our Healthy Filipinas Facebook page. You can reach out and call your closest friends po, no? So siguro parang just reaching out to somebody who may understand you, who can listen to you, who can be with you. That is a form of parang helping, not to cope with whatever unfortunate or negative feelings you may be having, or negative emotions, negative mindset you may be having during the holiday season. Of course, now if it reaches a point that you need professional help, please do call the NCMH. For substance abuse naman po, no, it is parang it's well within consumers' rights, especially DTI po ito, no, parang na may alcohol po in their celebration. So, but if, for example, you are celebrating at home or with other people, it is also one key one key way of preventing overconsumption of alcohol and becoming a threat on the road.
Sir, yung audio po ulit. Audio, sir.
And okay na?
Yeah, sir.
Yeah. It's one way that we can prevent being a hazard on the road or overconsumption of alcohol if yung mga kasama po natin sa ating mga gatherings will also point out, no, na parang, parang madami ka nang nainom. O parang, parang ka na magdadrive ka pa. So, remember, we showed na parang healthy communities, diba? So parang it's not just on the individual to be healthy with regards to consuming alcohol during the holidays. No? Parang dapat yung mga kasama po natin sa ating mga gatherings are also aware, no? And parang are also able to reach out to us. Huwag po tayong mahiya to tell somebody you've had too much to drink. No? Especially if you know that they will be driving, or you know that person cannot handle their alcohol. So as much as possible, of course, as we said, no, avoiding alcohol, but it's well within everyone's rights to consume alcohol during their gatherings. So yun, just be safe na lang about it po.
In short, drink moderately. Okay,
Yes.
next question naman po. Sir, how about the COVID-19 spread po? Minomonitor pa rin daw po ba ito ng DOH po, sir?
Yes, no, the case bulletins, they come out on a weekly basis now. No? So the case bulletins, I think, are released every Monday. This time, not on the Healthy Filipinas Facebook page, but on the main DOH Facebook page. So yung case bulletin po natin, I think, at the start of the year pa lang, we moved away from daily case updates to weekly case updates of the COVID pandemic, yung mga statistics natin on COVID. So of course, yes, there are new variants that are out. So our main goal, no, or our main message sa Health Promotion Bureau is to encourage everyone to get vaccinated if you haven't had your primary doses yet, and if it's been at least 4 months since your primary dose or your last booster, you can get a booster shot po for COVID. Yes.
Thank you, Sir Dino. Next question naman po. As consumers po, how can we further promote the healthy and safe celebration of the holiday season?
So, na-mention ko nga po doon kanina, no, na from what we eat, no, yung healthy, yung handaan po natin, let's have healthy options. No, I think I'm not an expert when it comes to yung mga price watch, no, but vegetable dishes, I think, are cheaper than meat dishes. No, kumbaga on a per kilo basis, I think. No, so not only are we going to be able to save a few pesos here and there, but we will also be able to put out healthy dishes. No, I'm sure madaming masasarap din naman na vegetable dishes. No, and for everyone, no, let's also try to balance our diet, especially ngayon, nagre-regaluhan po tayo ng mga brownies, cupcakes, cakes, dessert, di ba? Panay dessert yung usual exchange gift ngayon eh. But let's balance that, no? Wag po tayo magpakabusog sa sweets, sa too much sugar, and then ano pa ba for healthy and bad. So aside from complete nutrition during the holidays, again, proper toys, no? Age-appropriate toys that aren't choking hazards for little kids, that aren't electrical hazards for young children. No, if we can ensure po na yung toys po na ireregalo po natin, they come from a safe or parang trusted manufacturer, no, parang walang lead paint na nakakasama dun sa mga toys na nabibili, alcohol consumption, and of course fireworks injury prevention. So yun yung mga main goals po natin, no, Mayan. So dun sa 7 priority areas, I'm sure there are others as well that, parang can fall under having a healthy holiday celebration. But of course, yun nga yung 3 key messages natin sa DOH.
Thank you, Sir Dino. May gusto pa po bang magtanong? And so last call na po sa mga gusto pang magtanong from the consumers or private sectors. Otherwise, we will close the session na po. Question and answer portion, wala na po. Alright. Maraming salamat po sa mga nagtanong. Again, Sir Dino, thank you po for answering all the questions. We hope na mas napalawak pa ng session na ito ang kaalaman ng ating participants tungkol sa kahalagahan ng pagkakaroon ng malusog at ligtas na selebrasyon this holiday season. Before we close this session po, may we request po from Sir Dino a short message po to our participants and to provide them po Healthy Pilipinas or DOH contact details po should they have other queries or concerns po. Sir Dino? Turn your audio po.
Okay. Thank you again, everyone, for listening and attending this morning session. You may contact the DOH through our Facebook page, our website, yung doh.gov.ph. We also have a website for Healthy Pilipinas wherein we share yung mga health promotional messages natin, especially for the holidays. So that is healthypilipinas.ph. You can also visit us on Facebook. That's the Department of Health Philippines and Healthy Pilipinas on Facebook. Now, we will be sharing on Facebook as well our hotlines for our hospitals, yung mga sentinel hospitals po natin, and emergency numbers, especially in light of the coming holidays and New Year celebration.
Thank you, Sir Dino. We hope po pwede niyong ma-share kahit po sa chat box yung social media pages po that our participants can follow po. Alright. Maraming salamat po, Sir Dino. Thank you again to the Department of Health po. That is Sir Dino Hervasio po of the Department of Health Promotion Bureau. Sir, maraming salamat po. Let us now proceed. Thank you po. Let us now proceed po with the Christmas raffle draw. May we request po our webinar team to pull up our digital roulette for the draw po. Request lang din po namin sa participants na mabubunot at mananalo. Kindly turn on your video na lang po and para po magkaroon tayo ng photo op. Alright. So our first, let us draw na po our first winner. Tech team, please. Si Mr. or Miss Zamora po. Sir Von, nakikita po natin siya sa participants list. Sir?
Po.
Ayan. Sir, can you turn on your video po? Photo op lang po tayo. Hi, sir. Congrats po.
Thank you po.
Thank you, sir. Right. Next winner na po. Sir Benjamin Polikit. Sir Benjamin, are you with us po? 5, 4, 3, 2, 1. So, sorry, Sir Benjamin. Next, draw na po. Daniel Kodamon, are you with us po? From DTI, Ifugao, CAR. Ay, no camera. Alright. Sir, congratulations po, Sir Daniel. Alright. For our third winner naman po, next draw po. Sir Edgardo Galindez.
Yes, ma'am. Good morning
Hi,
po.
sir! Congrats po! Nanalo po kayo ng 500 worth of gift packs. Congrats, Sir Edgardo!
Thank you po.
Alright. Next winner na po. Ma'am Victoria Tagakay, are you with us po? Miss Victoria?
Okay na siya?
Saan siya?
Hello. Hello. Yan na.
Ayan, nandyan si Miss Victoria. Ayan, present. Congratulations, Miss Victoria! Right, for our last winner. Catherine Dizon, congratulations, ma'am.
Thank you po.
All right. Congratulations po to our winners. Kindly email us na lang po at cpab-cad@dti.gov.ph or kindly message us here po sa chat box. All right. Congratulations po ulit sa ating winners. We hope to see you po on our remaining webinars, and next year po, abangan niyo po ulit ang series po ng Consumer Care. This is to formally close our webinar po for today. Maraming salamat po sa ating very capable speaker from the Department of Health, Supervising Health Program Officer of the Health Promotion Bureau, Mr. Ricardo Noel R. Hervasio. At mula po sa Consumer Protection Group, maraming salamat po sa ating participants na nakasama natin ngayong umaga. Huwag niyo pong kalimutang samahan kami muli sa aming mga susunod na webinars. Our announcements po will be posted in our social media account. For more updates, please like, follow, and subscribe to our Facebook, Instagram, Twitter, TikTok, and YouTube accounts. DTI Consumer Care, DTI 1384, and DTI Philippines. Also, kindly accomplish and submit po the survey form para makakuha din po kayo ng link at para ma-download ang presentation na ginamit ngayong umaga. Thank you very much po and stay safe.
Para sa ating mamamayang Pilipino, para iwas daya dapat wais at alisto. Mainam maging mapagmatsyag at mapanuri tayo, palakasin ang boses ng ating mga konsumer. Dapat tama bawat presyo at serbisyo, produktong pasado, lalo ang mga pangunahing bilihin. Ang kalidad ng mga produkto at serbisyo ay pangalagaan ng lahat, tayo ay panalo. Layunin ng DTI ito,
ipatupad Price Act 7581, Consumer Act 7394, Product Standards 4109, for consumer care at iba pa, tayang 1384.
ipalaganap karapatan at tungkulin, kaalamang tama sa consumer ibahagi. Tulay sa kaunlaran, kalakalan ay palakasin. Ito ang pagbabago para sa ikabubuti natin. Dapat tapat bawat presyo at serbisyo. Produktong pasado, lalo ang mga pangunahing bilihin. Ang kalidad ng mga produkto at serbisyo ay pangalagaan ng lahat, tayo ay panalo. Layunin ng DTI ito,
ipatupad Price Act 7581, Consumer Act 7394, Product Standards 4109, for consumer care at iba pa, tayang 1384.
dapat tama, dapat tapat, mula sa DTI ito.